Good afternoon, everyone. Thank you so much for joining us for this special Grand Rounds on cultural responsiveness in healthcare. This event is sponsored by the Office of Community Health and the Office of Government Relations. Next slide. We have a great speaking panel today, who I will let Dr. Sherry Nethersall introduce. Just a quick housekeeping, questions will be answered at the end. Please type all of your questions into the chat box. This event is also being recorded, so if you or any of your colleagues or patients or families are interested in the event, please email us afterwards and we're happy to share the link. Next slide. And with that, I'm going to turn it over to Dr. Sherry Nethersall, the Executive Director of the Office of Community Health at Boston Children's Hospital.
Hi, everyone. This is Sherry Nethersall. I'm the Executive Director for Community Health at Boston Children's Hospital. I'm a pediatrician in the primary care practice here. I want to welcome you on behalf of both the Office of Community Health and the Office of Government Relations. Thank you for joining us for this special event in terms of honoring Latino Heritage Month. As always, we're really pleased to be part of Latino Heritage Month programming and want to extend a big thank you to the Spanish Team Collaborative for always including us in this event series. We always take special pride in being invited to participate. The Office of Community Health and the Office of Government Relations work very closely together. We collaborate on events like this and also on supporting policy initiative and community efforts that improve child and community health in Boston. We're extremely proud of the work we do together in our partnership. Today, you will hear from some experts who will discuss cultural responsiveness in healthcare. Sandy Habashi and Bernarda Montes de Oca from Boston Children's Interpreter Services team will share how they are helping Latino families within the hospital walls. We are also lucky to have Hernani Jose de Arajo from East Boston Neighborhood Health Center, one of our community partners, to speak to the needs of Latino families in the East Boston neighborhood, particularly given all the recent events that have been going on. And Maria Gonzalez Albuquerque from Healthcare for All will discuss the role of advocacy organizations being trusted partners with Latino families to advocate for their needs. At the end of the session, we'll have time for questions. And please use the Q&A tab in your Zoom menu to type in your questions. So with that, I will turn things back over to Jamie to go to our first speaker.
Thanks so much, Sherry. I'm going to go to the next slide. So now for the clinical perspective, I'm going to turn it over to Sandy and Bernarda.
Good afternoon, everybody. My name is Sandy Habashi. I'm the Director of Interpreter Services at Boston Children's Hospital. So today I'm mainly going to give you an overview about our department, as well as a deeper dive in the Spanish team in particular. Next slide, please. So I do report to Allison Scobie-Carroll, who is the Senior Director for Social Work and Family Services. And the way we have our department structured, that we do cover every single request for interpretation in the main campus, as well as the satellites. So yes, you heard that right. We cover the 22 satellites of Boston Children's Hospital. And the way it's structured, that we have our biggest teams who are Spanish and Arabic. And then everything else that is not Spanish or Arabic is under the all other languages team for the main campus, as well as the all other languages for the satellites managed by Luciana. And also we have Ricardo, who is our business administrator guy. We are just calling him the data guy. So Jeff and Haizem for the Arabic, Manuel for anything else, Luciana for the languages. I hope that some of you can remember their names, because they might be your best friends in the coming future. Next slide, please. So this department has been running for about 30 years. I have been with Children's Hospital for about 2.5 years now. The total number of our interpreters, we are talking between 70 or maybe 80, depend on the per diem here or there. And they are covering more than 10 languages. And as I mentioned, Spanish and Arabic are our biggest teams with biggest high number of requests, as well as interpreters. Next slide, please. So today, as we are talking mainly about the Spanish volumes, so I just wanted to share with you what have happened in our department during the pandemic time. So as you can imagine, I don't think it's a surprise for anybody that our requests were really low in April, and they were even lower during March. And then these requests started to pick up as things started to get back to normal, or the closest thing possible to normal. So with these numbers, I know that you don't know the numbers from the last year, for example, to compare it to, which I'm going to get to in a second to let you know what is the impact of the pandemic. But I just wanted to assure everybody that we were really in a very bad shape, I would say, during March and April. And by bad shape, I don't mean that it is just that the volume was lower, but it's mainly that we were concerned about, are these non-English speaking patients, and mainly the Spanish patients, are they getting access as needed to interpreters when they come in, or it was just that there were no Spanish requests coming at all. So this mainly was the thing that we were concerned about during the last few months. And as you see, the numbers starting to get higher, so this concern started to get relieved a little bit. Next slide, please. So these are the numbers. So last year, fiscal year 19, we were able to cover 77,000 approximate appointments only for the Spanish. However, this fiscal year that is ending in 2 weeks, and this is why I'm putting here expected, not actual number, because this is the estimation that we are expecting that by the end of this fiscal year, we would have covered 30,000 appointments. So now you can see that we are covering about 40% of the regular number of appointments that we would have covered in a very regular year. And again, this is not a surprise, given that we spent almost 6 months now in the pandemic era, yet it is still a concern, and it's still a flag of, are these patients getting access to interpreters as needed or not? And talking about all these health disparities and what was happening, I will switch now to Bernarda, as she will be able to talk with you about what has done differently in the department to address those health disparity issues that we were concerned about.
Hi everyone, my name is Bernarda Montes de Oca. I am a senior Spanish interpreter. This is my 8th year working here at Boston Children's Hospital, and I am very proud of being part of the Spanish team and the Interpreter Services Department. So next slide, please. So what have we done differently during the pandemic? So we started by translating a lot of documents that the hospital was creating for the families. So some of those documents were, for example, how to access Zoom. So we translated that into Spanish. That was one of the platforms that the hospital was using. The other one was SBR. Other thing that the department did a great job was they were able to add Spanish captions to some of the instructional videos and webinars that the hospital was creating with new information and protocols for the family. I want to point out that we are an interpreters department, not a translations department, and that means that most of the work that we do is done orally and not written. But we had to adapt very quickly at what was happening. So we also created a document with instructions on how to request interpreters to join those Zooms, all those virtual appointments that were being created. Also, as interpreters, we are very proud that here at Children's, we do most of our work in person. So that meant that we, as interpreters, needed to be trained in how to become telehealth interpreters. That is not the same. So as a team, we were working together, sharing webinars and all the experiences that we had to be able to get ready for what was coming next. And these had to be done very quickly. One of our roles as interpreters is to advocate. And we knew that in this situation, the need for advocacy was rising. So we were very concerned about our families and how the pandemic was hitting them. There were many health disparities, as we know, and economic disparities, and the language barrier was a big barrier that was put in between. So that meant that we as interpreters had to wear a lot of different hats and learn to adapt to what was happening. Are you ready to see how many different hats we had to wear? Next slide, please. Next. There we go. So as you might know, the role of the interpreter is to facilitate the communication. Next one. And that we do it by conveying a message. Sometimes we need to clarify, we need to act as cultural brokers, and we do some advocacy. During the pandemic, as I mentioned before, advocating was a much bigger role. So post-pandemic, next one. We had to do all the above, plus we had to be do a lot of customer service, technical support, and all that we did it mainly over the phone. And the interesting thing is that we were not acting as interpreter. Many times we were contacting the families directly. All the families were very happy to hear our voices. I have to say, I don't know if you know Spanish, I'm from Argentina, I have a distinctive accent, and many families were even able to recognize my voice when I was reaching out to them. And it felt really good to them and to us to be able to stay in touch. Language lines, as you know, that is used for interpreting, were very busy. A lot of the interpreters there were taking care of COVID cases. And luckily that was not the case for children's, but interpreters were still needed. So we were able to be in that role and contact the families. Also, we had to do a lot of adjustments with Zoom and SBR. SBR is a platform that the hospital was using pre-COVID, and they could request an interpreter almost instantly. Again, because of the high demand of interpreters, it was really hard to get interpreters on the SBR platforms. So we, the BCH interpreters, were available to help. So we did a lot of interpretation over the phone while the providers and the families were on the screen. And that was also completely new for us. With Zoom also, we had a lot of technical issues, so we had to do some of that too. Sometimes we even had, the screen, and we had the phone on speakerphone, or we had to learn how to do conference calls on our own cell phones to be able to facilitate the communication. But we couldn't leave our families behind. We knew that they needed our help. I remember later the department was able to arrange so some of the BCH interpreters were able to join the SBR platform. And I remember the first call I had, the Dr. Latino and one family in primary care showed up on the screen, and we were all surprised. We were all surprised because in 3 weeks, all of this had to happen. The pandemic came really fast, and we need to find solutions to be able to reach out to our families and fulfill their needs. One thing I would like to mention also is that we were always also present in the hospital for the inpatients if we were needed. Because of the health risks, many times we had to zoom in into those rooms, but if an in-person interpreter was needed, we were available at the hospital. So next slide, please.
So as Bernardo mentioned, during the pandemic from day one until now, there wasn't a single day that there was no in-person Spanish interpreter as well as Arabic interpreter. As I mentioned, they are our biggest team that was not present in the hospital. So mainly what are we trying to do next? So we have been working on multiple projects with several departments in the hospital, several teams, because we are really trying to improve a lot on the way that all the non-English speaking patients are having access to interpreter services. So one of the projects that we are proudly working on now, that we are trying to reach to every single Spanish patient, as we are piloting first with the Spanish population, about how can they create a BCH profile on the portal we have already sent the translated material to them, and yet we are now taking it to the next level, that we are trying to reach out either by phone or even to schedule a Zoom appointment to make sure that we are walking with them through the different technical issues that they might be having. As Bernarda said, we interpreters all together now are wearing the IT support as well. So another thing that we are trying to work on and had some success already with is trying to establish our own call center in the department. This way, when you are calling language line, for example, or when you have a patient who is trying to connect with a clinic, you will be able to get to us first. And to us, I mean BCH interpreters, to help you with these calls. And this way we are trying to be as efficient as possible rather than just routing all the calls to a third-party vendor. During that time, also, we have been trying to get as many interpreters as we can on the different virtual platforms that we have, whether it's Zoom, SBR, or whatever another company is coming. We have been trying to equip our team and our interpreters by the right devices, the right equipment, as well as the very much needed skills or new skills that they needed to acquire of how to interpret over the phone and over the video, which is a completely different skill than doing it in person as they used to do. The one thing that I'm going to leave with you to dream with us about, that we are really dreaming of having our own translation team in the department to expand more on the translation. We do have a very small team currently, but we are really dreaming of that day where all our resources in the hospital would be able to get translated by our very talented and professional interpreters / translators when we get to that point. And this way, again, we are going to increase our efficiency and be even more engaged with those last-minute discharges that are taking place, or this education material that need to go to the patient in a very tight time, I would say, in Spanish. So one day, hopefully, this dream will come true at BCH. Now I will leave you with the last slide with Bernarda.
Hopefully, after this presentation, you know a little more about the department and how important it is to have interpreters. So here are the instructions on how to access interpreter services. We work a little separately, the main campus and all satellites. Waltham includes all the satellites too. And at the bottom, you can see there's a email address for feedback. So if you have any concerns, complaints, compliments that you would like to share, so please do email them. This email goes directly to our director, Sandy Habashi, and she will be responding and getting back to you. Thank you very much. And now—
Thank you so much for that.
Thank you both so much. We really appreciate it, and all the hard work that you have done for the families at Children's over the last many years, but specifically over the COVID pandemic. So I'm going to have Alexia move us to the next slide, and we're going to switch gears and we're going to hear from Ernani, and we're going to talk a little bit about the community perspective. So Ernani, if you want to turn your camera on and go off mute, I will hand it over to you.
Great, thank you very much. Well, hi everyone. I really appreciate the opportunity to speak here. I'm Ernani Diarujo. A little bit about me. I'm a vice president at the East Boston Neighborhood Health Center. I'm the chief legal officer, oversee our legal affairs, and also just our general regulatory matters, including government affairs. Thank you. And, but most importantly, I'm a lifelong patient of the health center. I've had family members. Most of my family members are patients of the health center. They have at some point in their lives probably worked at the health center. So, you know, very proud to be able to bring the skills that I've been able to build up over the years to EBNHC and to help our patients and help my family as well. So if we can go over to the next slide, please. So I want to talk to you a bit about, for those of you that, you know, Children's, first of all, is an excellent partner of the health center. You know, we're deeply grateful to have the expertise, to have the referral relationship, which, you know, we have one of the largest pediatric departments in New England. So very, very important for us to have this relationship with you. So you probably know about us, but just to kind of talk to you a bit about the health center. We now serve over 100,000 patients following our merger with the South End Community Health Center in July in the midst of the pandemic. Over 70% of our patients identify as Hispanic or Latino. Major populations include folks from El Salvador, Colombia, and Puerto Ricans with our South End and Roxbury move. That is, the mix has changed over time, and it really tracks the history of immigration to East Boston in particular, but also the greater Boston area. So now I think the largest group, the predominant group overall, are folks from Central America with Salvadorans, Hondurans, Guatemalans, and Colombians, who were the predominant group in the 2000s, have now kind of moved out of East Boston, but into our other service areas, including Chelsea and Revere. So talk about our service area. So Chelsea, Revere, kind of our main areas, and then Winthrop, Everett, and we just added the South End and Roxbury, which we're getting to know and help our patients in those areas as well. Our workforce of over around 1,200 staff members, half of those folks come from the communities that we serve, and we very intentionally reach out to our communities to hire, doing our job fairs, through our Adult Education Institute, trying to grow individuals from the community to build up their skill set. So, they may start off working in one department with a certain skill level, and then we build them up to more complex or higher skill levels so they can take jobs throughout the health center. The best example is our chief executive, Manny Lopes, who started, I think he was 18 in phlebotomy, and then worked his way up to our IT department, and ultimately to now lead our organization for the past 7 years or so. Also, a patient and his family, patients of the health center as well. And a key thing, I'll also note, so of our staff coming from the service area, 42% identify as Hispanic Latino as well. And we are working, we started an initiative a few years ago now to ensure that our staff overall reflect our service area. But really important for us was that our manager level and our senior team level also reflect that as well. And like, organizations across the Commonwealth and across, the United States, we have a lot of work to do in that front, but we've done a lot of work. We've built up a lot of folks. Of course, it's always nice when you build someone up and then, they may go off to other opportunities, but we're very happy with the work that we're doing in that space, and we'll continue doing to ensure that we represent our community well. And just the last point on here, but also I really think the most important point about the East Boston Neighborhood Health Center is that our board of directors is made up of majority patients. And that's part of that is for statutory reasons, as being a federally qualified health center. We're required by federal law to have majority patients on our board, but it's always been our mission. We were founded over 50 years ago now, and at that time, the predominant immigrant community were Italians coming into East Boston that needed primary care, that because of the geographic isolation of East Boston, those of you may know, have obviously been to the airport, surrounded by water, the tunnels, we now have, another tunnel, we have another bridge, but just, isolation geographically, but also isolation of an immigrant population that didn't, for all the reasons that we understand, systemic reasons, didn't feel they had access to so-called downtown facilities and hospitals that were maybe more readily accessible for folks of means or of different social status. So we serve everyone without regard to their ability to pay, or without regard to their social status, immigration status, wherever that might be. We, as of 2019, and I think this is, the overall number, we serve the largest uninsured population in the Commonwealth. It was around 20% last year. I think that's kind of fluctuated a bit based on immigration. And so our board of directors, who are our patients, they make sure that we always hew closely to our mission. They are, and when we talk about our pandemic work in a moment, they really, because they live in the community, they get their care at our facility, they have the ear of everyone, of themselves and of our community members. So they've suggested new programming, changes to programs, encouraged us to raise funds in certain areas for certain issues, which I'll talk about a few now. So very different than I think the usual healthcare institutions you think of, where you may have a board where you might cultivate folks who have certain expertise or ability to fundraise, which of course is very important for all of us. But really, we're patient run, and we're very proud of that. If you can please go to the next slide. So I want to talk to you a bit about, in the next few moments, what we've done during the pandemic, and in particular, some of the issues that have come up with our Hispanic and Latino population. And so, like all of us, I think we were, in some sense, we were prepared in that we had an infrastructure, we had folks that understood infectious diseases. We did a few things community-wide, which in the end ended up being prescient, that really helped us during the pandemic. And one that I'll highlight first is that in January, we called together all the nonprofits in East Boston that we have very good relationships with, that touch on services to our patients. We serve over 70% of East Boston residents. And there's about 50,000 or so residents in East Boston. And so we convened this group, and really it was to improve communication, to ensure that we're all working together to serve our unique population. Some of the key issues were food insecurity, issues around immigration, which I'll talk about in a moment. And so we built that platform, that communication to deal with our kind of longstanding concerns in our community. And that really was a great platform throughout the pandemic, because we were able to collaborate closely with organizations that provide affordable housing, organizations that provide food services, that provide immigration services. And so, in kind of in the terror and the terrible moments in March and April, there were also the wonderful moments of really just folks working together. And as we identified needs, someone found a way to work towards bridging that gap and meeting many of those needs. So very proud of that community network that we built, and then are continuing to use. Another piece of that was that we could also jointly apply for funds. As funds became available, the Mayor of Boston put together a resiliency fund that has sent millions of dollars to the immigrant communities in East Boston. And we were recipients of many of those funds, as were our network of nonprofit partners. So very important there. I'll talk a bit about kind of what our general response was with COVID-19, and then how that tied into specifically with our population. So like every other healthcare institution, we opened up quickly an incident command. We actually developed and published a COVID-19 playbook focusing on primary care and focusing on dealing with immigrant populations in particular. We're the largest community health center in Massachusetts, and about the 4th largest in the United States. So we do play a big role, and when we develop best practices, we try to disseminate those best practices. And it was great to hear about Children's Interpreter Services Department. That was one area where we've made substantial investments as an organization over the years as well, and ensuring that the transition to telemedicine, that the work was seamless in terms of interpreter services. Of course, it's not seamless, but we did our best to make it as effective as possible for our patients. We quickly changed our buildings, and this was really listening to our patients, hearing on the ground, and trying to get the best information we could about folks that were afraid of coming into our buildings. Folks didn't want to go in for their well child visit because they were afraid of, if I bring my child in, to get their vaccination? What if they encounter someone, who has COVID? And, very real fears. And, you've dealt with it. I'm sure you've heard of that. So we developed a mobile pediatric vaccine van to go out and ensure that, there's not another, an outbreak of some other disease because we're not doing the basic work that we should be doing to ensure that folks are vaccinated. And that came from concerns expressed by our patients, and basically someone saying like, could you meet me outside? And the answer is yes, we can meet you outside your house. And we've been doing that. Telehealth was the biggest thing. That's something that we've been advocating for as a health center, as long as I've been there. And it's just, extraordinary that we've so rapidly moved to expand this really important service. Just kind of as an aside, as the health center's attorney, in March and April, I've never seen, and hopefully, I don't know, I probably won't see this again anytime soon, but to see regulatory agencies really from one day to the next change regulations that were in place for, who knows how many years, and allow us to do the things that really we needed to do to serve our patients. One of the concerns that our providers raise around telehealth is how do we communicate with our patients that might not have access to the internet, might not have access to smartphones, might not be comfortable using that type of technology, even if they do have access to it for medical and health purposes. And really, these were barriers that that are real and continue to be a challenge. But we've leaned heavily on the relationships that we've built with our patients over time, that we can call. If it's usually we see the whole family. If there's one family member that we can say, hey, if you can get your mom on the smartphone, we can maybe do 60% of the work that she needs done for a visit. And I see the 2-minute warning coming up. So basically a lot of work on telehealth and being culturally sensitive on that. I want to note the numbers I have down here for positive tests and testing. They are not, they've been updated since then. We've become one of the biggest testing organizations in Massachusetts. We have worked very hard around the billing around these issues. So the immigration issue has come up where folks are concerned. There's the public charge issue, which I'm sure you're all familiar with. We've been trying to let folks know that, as far as we know, the current federal administration has said that these treatment for COVID will not impact public charge issues. But it is a real challenge. We do have a federal administration that has taken a view with respect to immigration of all kinds that is not a supportive view, and in many cases is actually antagonistic. And so it is hard to convince our patients, but our relationship with them has helped us to do that. And then, finally, I'll just note that one of the biggest things that came out of some of the work we've been doing is the issues around inequality. So we've worked very closely with families throughout this pandemic around food services. We've delivered thousands of meals. We've been working with the city to encourage direct payments to families to help them with rent, with just paying bills. And so all of that is just that cycle of patients letting us know what they need and us being advocates for them. And we take that role very seriously and consider that a very important role that we have. So with that, thank you very much.
Great, thank you so much. And thank you for all the work that you've been doing in East Boston during the pandemic and well beyond. They're so lucky to have such a supportive community health center in their neighborhood. With that, our last perspective is the advocacy perspective, and I'm going to turn it over to Maria.
Great, thank you. Thank you for having me. My name is Maria Gonzalez Albuquerque. I am the Director of Communications and Immigrant Health at Healthcare for All. Next slide. Next. I think that most of you know Healthcare for All, but we're a nonprofit organization that has been around since 1985. Our mission statement is to advocate for health justice in Massachusetts by working to promote health equity and ensure coverage and access for all. We work in coalition and work in different policy priorities, such as access to oral health, access to children's health, immigrant health, etc. Next. And this is, I think, I'm going to be talking a little bit about how to connect with the Hispanic community in Massachusetts. And Healthcare for All has a tool that is critical for our work, which is our helpline. We have this helpline that is available 5 days a week over the phone to help people navigate the healthcare system in Massachusetts, to apply for health coverage and understand what kind of health services they can access in Spanish, Portuguese, and English. And it has been a great tool to really connect our communities and to build that trust. Next. But yes, how do you build trust with the Hispanic community? And as an organization that has been working with Spanish speakers and Portuguese speakers for many, many years, we think that it's very important to be consistent. Like, if you're always going to help your community, if every time they call the helpline, they're going to get a similar result, they're going to get their questions answered, you're going to get a better chance of building that trust. Also, very important to partner with the community and with the community organizations versus using the organizations or the consumers you work with for certain events or priorities, instead of just really establishing that partnership from day one. Tokenism is actually something that we're still fighting with, because sometimes you're just trying to find the right consumer that fits your priorities. But at the same time, I think that we've proven throughout the years that partnering with the right organizations can give you great results. And I'm going to give an example of how we do this. In the next step that I'm going to talk about, we're back. Can we go back? Yeah. Is how do we move beyond cultural and linguistic competency towards cultural humility? And that's very important, because we all talk about interpreting, we'll talk about translating, but that is not enough. And you heard from the interpreters that they do much more. They do that cultural bridge, right? And the truth is, we don't know everything about everybody in all the communities. As a member of the Hispanic community in Massachusetts, I can tell you, I just know what I know, but it's very important to recognize a few facts. The Hispanic community in Massachusetts is very diverse. It's not all Hispanics are immigrants. So that's another, I would say, myth that people don't understand. Also, being Hispanic is an ethnicity and is not a race. And our community is racially diverse. And that's very important as well, with all these racial justice issues that we have been fighting in the last few months and years, of course. Also very important that not all communities speak Spanish as a first language. It's also important to highlight that second generation tends to be more comfortable speaking English, and other communities actually speak other languages. We have many Guatemalans whose Spanish is not fluent, and they speak, for example, Maya Quiche. And we have people that speak Quechua, for example, from Peru or Ecuador. And then I want to go into this issue of, do we call them Latinx? Do we call the community Hispanic? Do we call the community the Latino community? So I just want to highlight that there's this trend of using the word Latinx, because it tends to be very inclusive. It doesn't have the gender difference that we have in Spanish, which is Latino, Latina. The problem with this is that our community is not going to identify themselves with that for the most part. You're going to have Latinos that are usually younger and more highly educated that are going to use that term, but you're not going to be able to translate it effectively, and you're not going to be able to get that message across to our communities to tell them that they're stop being Latinos all of a sudden, and they become this Latinx that doesn't even speak to anything in Spanish. So we need to be very careful. It's fine to use Latinx. I understand the inclusiveness that it implies. We use it, for example, Healthcare for All, when we do development work, so proposals and reports and so forth, but we would never use it when we do direct communications with our communities. Another thing that I want to highlight, and I think it came up today, is that Spanish is not an ethnicity. Spanish is actually a language and a nationality. So Spanish, people that are Spanish are people from Spain. That's why you have to refer to the community as Hispanic or Latino, or even South American or Central American, depending on what you're talking about. But be very careful not to call the community Spanish community, because Spanish is just a language, or if you are from Spain, like in my case, Spanish means that you are from Spain. Next. So this is also very interesting. The Latino community in Massachusetts, as I said, is extremely diverse. We have representation from many, many countries. Some of the Caribbean populations that are represented the most are Dominicans, and now we're everywhere, but these are like some of the areas in which you're gonna see, for example, more Dominicans in Lawrence or Jamaica Plain, for example. You have a lot of Puerto Ricans also in Lawrence, in the South End, in Holyoke, and so forth. We have a Cuban community that is more integrated, more dispersed. We have a lot of Central Americans, such as Salvadorans, for example, in East Boston, and they have been, Hernani had a very good point. This really fluctuates with the economic changes as well, and many of them have been pushed outside of East Boston. I don't know if the pandemic is going to slow down this process of gentrification. We have a lot of Guatemalans as well, and in communities such as Linworth and New Bedford, but even more. We have Mexicans, actually. It's not obviously as in the South. We don't have that large of a community, but it is widely represented. And we also have people from Honduras, Nicaragua, Costa Rica, and Panama. And we have a lot of people also from South America, Colombians in particular, but we also have a very large Uruguayan community in Fitchburg, and we have a lot of Venezuelans, we have Chileans, we have Argentinians, and I know I forgot one community that is actually pretty large that we have here in Massachusetts. But so this is like an example of how we look at the different communities and how different they are. And it plays a role because depending on the country they're from, they may have some immigration statuses that belong to them. For example, we have many Salvadorians in Massachusetts that are that have TPS, temporary protection status. We also have many Dominicans that have been around for a longer time and may be US citizens. Puerto Ricans are not immigrants, as I pointed out before. So these are, it plays a role to know where the person comes from, also because we have linguistic differences, cultural differences, and different foods and things like that. And that's very important to understand who you're talking to. Next. Very important. So these are organizations that work in Massachusetts. Hernani pointed this out when he was talking about what they did in East Boston. It's critical to partner with the organizations that serve our communities directly. For example, we have worked in the past with many agencies, and we keep working with them. But it's if you want to help the communities in Chelsea, you really need to talk to the Chelsea Collaborative first. You need to talk to Gladys Vega to understand what the needs are before you actually jump in, because they have a knowledge of what's happening on the ground, but they also have that trust already, and you're not going to get to those communities without the trust. Or you can use you can talk to Centro Presente. They work very closely with Central Americans, especially in East Boston, but throughout the state. Or if you want to talk to specifically communities, many undocumented communities in the South End, you talk to Agencia Alpha. They provide a lot of immigration services, and they are connected to a church that is very prominent in the Hispanic community. You need to know these organizations and how to partner with them in order to get to the community. Another trick that Healthcare for All uses a lot is really working with with community serving media. We're trying to change our language, and we're using community serving media as the way to describe what people used to call ethnic media, because they serve specific communities, and it's not necessarily ethnic diverse. It can be other factors. We work with Univision, we work with Telemundo, we work with El Mundo newspaper, Planeta, La Voz de Lin, and other newspapers and other media outlets that are located throughout the state. And you also need to take into account that there are radio shows that actually are specific for the different communities. So if you're going to work with Colombians, you may want to talk to the magazine AM, or if you want to talk to Salvadorians, you may want to talk to Dani Gutierrez or Ritmo Guanaco. You need to know who you're targeting so that you can actually find the right show for you. So this is very important for us. This work is critical, and we work very closely both with organization and with community serving media. Next. So having this as a background is like, these are the tools that we use to build that trust with our communities. I have to tell you that we had to navigate this really, really hard time with the pandemic and public charge. So there's two things happening at the same time. And Nani talked about this public charge rule that you guys are familiar with. And we saw people not seeking services. We have this example from this resident actually of East Boston who did not dare to go to the hospital or get services. And for two reasons, he had symptoms and he was just very scared. He thought that it was going to impact his immigration status, or that he was going to get arrested by ICE, or his son and his wife was, and also that he was going to get medical bills if he went to the hospital. First of all, he actually had status. He had temporary protected status, and he would have been safe. And you know for a fact that any services related to COVID were not part of public charge. And also there's no medical bills associated to those services, but it didn't matter because the fear is such that it doesn't matter that you give them the facts. And I actually was doing a training in which I was talking about this case that got us all advocates were really, really sad to see this story on the Washington Post. The organization that tried to help them was serving the wife. I think it was, the wife was learning English, was going to English classes, and they trusted that organization, and they kept telling them, please have your husband go to the hospital, please have your husband apply for insurance. It doesn't matter, like it's not gonna impact their ability to, you know, immigration or even he's not going to get medical bills. But it's just such, the fear is such that even organizations that have the trust were not getting the message through. And I think that's what we're fighting right now, what we're seeing right now. Even trusted organizations have a hard time getting the message through. It's not just the message, it's also the messenger. But at the same time, right now, we are stuck with many families because it doesn't matter that they trust you. They may trust their lawyers. The lawyers may not have all the information. So even if you build all this trust, these extra circumstances that we're living through are making things way more difficult than they were before. Next. So what we did when we heard these cases is we did an educational campaign in social media in Spanish, English, and Portuguese. We did a lot of interviews. We partnered with these community organizations that were serving different communities, and they all have their Facebook page, and they have their Facebook lives that they do at a certain time every week and so forth. And we were like trying to like get the word out that, you know, there won't be any medical bills, that they shouldn't worry about public charge in terms of COVID-19 or even health insurance in general, really. Giving all that information, also all the public health information that was needed for our communities, because we were hearing from hospitals that Hispanics were really being hit hard by the pandemic because they did not have the information. So we've been doing a lot of things. We've been doing a lot of trainings. We did a PSA in collaboration with Agencia Alpha that was placed in virtual religious services of every Sunday, reminding people, please go to the hospital if you feel sick. Don't worry about your immigration status. You have the right to see a doctor. You have the right to apply for health insurance and so forth. And then we've created a lot of resources in different languages. We created a section on our website on COVID-19 with all this information, created flyers. We actually had flyers distributed in packages of food for people so that they have that information in their hands. I mean, we've been fighting this. This is the way to do it, is really building that trust and connecting with the community. But I'm just gonna be honest, I think that we're facing circumstances that we not faced before. And even with that trust built, you're not getting through the community because the fear is it's there. And as long as we have this federal administration, things are gonna be very hard for our communities and for the work that we do with our communities. And we also had a series of trainings for our communities. Next. And I think that's my part. So I think I'm right on time.
You're perfect as always. Thank you, Maria. And thank you for Healthcare for all the work that they've been doing. So I'm going to ask all of our panelists to go ahead and turn their cameras on, but keep themselves on mute. I'm going to ask Alexia to advance the slides. A couple of you submitted questions along with your registration, so we're going to start there, but I'm going to encourage folks on the call to go ahead and type your questions either into the chat box or the Q&A as we get started with our questions. So I believe this first question is for Maria. What specific bills or action items can we pursue to help support our Latino families and patients?
So there are different ones. I'm going to talk about on the federal side. It's not a bill specifically, but we're going to keep fighting this public charge rule. I think you guys need to pay attention to what's happening. There's a legal roller coaster to see if we can stop this rule. At the state level, there are many bills that can be helpful for communities, such as the Safe Communities Act is a bill that would really protect our communities. And it's really trying to avoid the local police becoming like ICE agents. Is really protecting our communities to ensure that they can trust the police, that they can go to the ER, they can use the services. That's a very good one to protect communities. We have bills, for example, to expand services for children, immigrant children, and expand health coverage for immigrant children. There are other bills, for example, to help people, help healthcare professionals work in Massachusetts that can also help our Latino families and communities. There are many, depending on if we're talking about healthcare, if we're talking about protecting immigrants in general. I think Safe Communities Act is one of the ones that I would recommend.
Thanks, Maria. And can we find more information about the Safe Communities Act on the Healthcare for All website?
Yes, I can definitely post more of that. It's supposed to be there, but I'll do it again.
Great, thanks so much. I think this next question is for our two folks from Interpretive Services. In addition to providing interpreters, does the hospital have any guidance around pairing patients with Spanish-speaking providers?
So what we are trying to do now is to make it, to establish a very clear new policy, I would say, for the bilingual providers, and have like a clear system on our side to identify who speaks Spanish, who speaks any other language. But for pairing or scheduling the Spanish-speaking patient with those providers, I don't think we are there yet, and it will always be left up to the patient's choice if they want to be scheduled with this provider or someone else. But our side is that we will make sure that it's clearly identified to the patients.
Great. Thank you so much. I'm going to kick it over. We have a question on the Q&A chat box. Are there individual departments and programs, are there ways that individual departments and programs at the hospital can help families out who are experiencing hardship during this time? Are there places that we can fundraise or submit donations to? And I'm just going to open this question up to everyone, because I know that all of your organizations are great places to submit either monetary donations or others. So why don't we start from inside the hospital, and then we'll work community and advocacy. Sandy and Bernarda, any familiarity with where folks can donate?
I don't have anything in mind, to be honest.
Well, I'm happy to just jump in and say that the Hale Center for Families is a great place. They are always looking for resources and for folks to help out. And you can get in touch with them for more information. Ernani, anything on the community level that people can donate to?
I mean, there are a number of organizations that we partner with. I mean, obviously the Health Center as well, but like Centro Presente, some other organizations that are Chelsea Collaborative that are doing a lot of work, and we're recommending folks to look to those organizations to support as well.
And Maria?
So besides obviously Healthcare for All, because we do a lot of this work, and I was going to suggest some of the organizations that I had here, which Ernani mentioned. I think that one of the organizations that has been amazing during this pandemic is the Collaborative, the Chelsea Collaborative, but also Centro Presente has been giving food. Agencia Alpha has been also distributing food. There's a lot of organizations out there. And if you want a list or how to help the community, you can always reach out to MOIA, the Mayor's Office of Immigrant Advancement, because I don't want to have one organization on top of another. They have a list, they can check who's been doing this work and how you can actually donate.
Jamie, I'll add also, if I can butt in.
Of course.
From the internal perspective at Boston Children's, for folks to keep in mind our own primary care centers, both our primary care center at Longwood and Martha Elliott, which has a very large Latino population. And there are definitely both community organizations that Martha Elliott partners with, as well as the housing development right next to it that are definitely partners in terms of needs for hardship services.
Actually, Sherry, that's a great lead into our next question that maybe you can help us with. Speaking about Martha Elliott, what are some of the factors causing the major health disparities within the Latinx community? And then Sherry, maybe you can take the first part, and Ernani, you can take the second part.
Sure. I mean, I think I put out there, first of all, that we don't completely know all of the answers. We have some idea. You know, we know that one of the things that contributes to your health, aside from just your healthcare access and you know, your genetics and all of that, are the social and environmental factors that you are circumstances in which you are raised, as well as sort of those your individual health behaviors around exercise and physical activity and eating and all of that, which are influenced by that social environment in which you are raised, in those social factors. So I think that there are, and such as poverty and unemployment and education and all of that, in addition to access to services. So I think that it's multifactorial, that part of it is around, purely around income. Part of it is around housing and housing stability and housing conditions. I think a part of it is around, you know, issues of sort of, particularly for COVID-19, issues of people who are essential workers and are still exposed to a larger population on an everyday basis and don't have the ability to socially isolate in the same way that others who can work from home. So I think all those things are factors. And I think that there are some factors we don't totally understand still.
Thanks, Sherry. Ernani, anything to add from the community health perspective?
Yeah, and first I'd just like to say I really appreciate that response, because there has to be a sense of humility, especially since this kind of, you know, we're not looking at data that we've from years in the past. This is happening in real time, and sometimes if we hone in on a particular factor, we might make a response that, you know, isn't emphasizing something else. And so as issues came up, so for example, communication was a key piece for us. How do we best communicate with our patients? Looking, you know, one example was social media. Do we use Facebook or Twitter? Maybe not big for our patients, but everyone seemed to have WhatsApp in the Colombian community. So that was a great tool to use. We use a texting service. We realized that we work closely with the Boston Public Health Commission, that a lot of the public health messaging that we could see in some cases was not penetrating our patients. And in one of our meetings, I give an example of my mom's side of the family is Colombian, and they're first generation, and they all watch the news from Telemundo Univision, and they can tell you what the mayor of Bogota is doing, but they might not be able to tell you what Mayor Walsh is doing. And then so it's like, how do we get the messaging there? And we work really well with Telemundo Univision, with the Public Health Commission to get those messages out, and then just the real just basics of, we did literature, kind of like a political campaign, like literature drops, going to the doors. You know, folks aren't gathering, which is good, but wherever we could find people in a socially distant way, trying to get into their hands language appropriate materials. So, you know, that was a key piece. And the other piece was, we've known for a long time that East Boston has among the highest rates in the city of Boston of overcrowding. So not so much density, but just lots of families in, you know, in one or multiple families in one space. And our messaging to families try to work through those issues and try to connect with multiple folks who might be sharing one apartment. So.
Thanks so much, Ernani. And thank you to everyone on the panel. I know I learned a lot today. The resources that you shared were phenomenal. We will be sending out a follow-up email after this with all of the resources that you sent, the organizations that you work for, ways to get involved. Remember, the Office of Government Relations and the Office of Community Health is always here to help you navigate this space at Boston Children's, and our outside partners. We thank you for being here today for this important topic. Thank you all for celebrating Latino Heritage Month with us. We really appreciate it. If you have any questions, you can reach out. Other than that, have a great rest of your day, and thanks so much.
Thank you.